So if we want to have an example, then that is how much fluid will be needed. Suppose we have a 25 kg dog with 7% dehydration. So first we will see what is the existing loss. Existing loss will be 1200 milliliters. So in such cases, actually, now we have to decide, that is how much fluid is needed, what type of fluid is needed, and what will be the rate of administration of that fluid. So these are the three main things with us which we should consider here. So going back to the 25 kg dog with 7% dehydration, if you calculate, the existing deficit will be 1750 milliliters. The continuing losses, you know, which may be due to diarrhea or due to vomiting, maybe it is 600 milliliters, or the maintenance needs, we will calculate at the rate of 2 milliliters per kg per hour. So it comes about 1200 milliliters. So if you have the total fluid volume which is needed for this animal, that will be 3550 milliliters. So we just, for the ease of making a round figure, it will be 3600 milliliters, just for the ease of calculation. So if you want to replace half of it in the first 4 to 6 hours, or maybe we can replace it in the first 8 hours, that all depends upon the condition of the animal you are dealing with. Sometimes we might have to give the fluid very fast, so we can even give half of it in the 5 hours. It may go up to 10 hours, but the rest of the half of the fluid, that we normally give it in the remaining 12 to 18 hours. So suppose in this example, we have calculated 3600 milliliters of the fluid, half of it will be 1800 milliliters. Suppose we want to infuse it in 5 hours. So we will calculate it like 1800 milliliters divided by 5 hours. It will be 360 milliliters per hour. So the normal drip rate which we use in the clinics, that gives us 10 drops per ml. So 360 milliliters will come up to 3600 drops per hour. So if you divide it into by 60, it will be 60 drops per minute. Then again you divide it by 60, so it will be 1 drop per second. So like that we can calculate with all the fluid drip rate which we want to set in. So as far as electrolyte disturbances are concerned, normally in the body we see the potassium and sodium abnormalities. So potassium and abnormalities, they may be hypokalemia or hyperkalemia, or the sodium abnormalities, which may be normally hypernatremia or hyponatremia. In hyponatremia, as I have told you before also, that it is usually noticed in adrenocortical insufficiency, where the sodium is excreted and potassium is retained. Also in chronic renal insufficiency, we can see this problem. Or if we replace isotonic losses with 5% dextrose, the animal will undergo hypotonic, hyponatremia. In hypernatremia, again may be noticed in 2 liter water intake, excessive losses from the respiratory tract, or diabetes mellitus also, it results in hypernatremia. The other condition which we see is the hypokalemia, which is usually seen in prolonged anorexia, vomiting, chronic diarrhea, diabetes mellitus, and alkalosis also. In cases of alkalosis, because there is less hydrogen ions in the extracellular fluid, so the hydrogen ions, they will come out of the cell, and as a result the potassium ions will go inside the cell, so the result will be hypokalemia in the ECF. In acidosis, hyperkalemia may be seen. Also it may be seen in adrenocortical insufficiency, urethral obstruction, or acute renal insufficiency. So the normal solutions and additives which are routine in use and which are easily available in the market, we are going to give you the list of that so that it is easy for you to figure out what type of fluid is needed for that animal and how it is available in the market. Normal saline solution, we know it is isotonic. Normal uses are the hypotonic dehydration, but it is an acidifying solution because when we give sodium chloride, it splits up into sodium and chloride ions. Chloride ion has greater affinity for the hydrogen ions, so they will make hydrochloric acid. That's why we say that this normal saline solution, of course, it is isotonic, but it is acidifying solution because it ends up in hydrochloric acid. Dextrose 5% is also isotonic. We normally use in hypertonic dehydration. Dextrose 20% is more hypertonic. Osmotic diuresis, when we need osmotic diuresis, we can use this 20% dextrose. Or in cases of hypoglycemia, in cases of diabetes, when the animal is suffering from hypoglycemia, we can give this 20% dextrose. Then we also have 50% dextrose, which is also hypertonic, and we can use it in parenteral administration in severe cases. Ringer's solution, it is a very good solution. It is isotonic. It is polyionic, have many ions in it, and it is for polyionic replacement. We normally recommend Ringer's solution, but it is also acidifying solution. Then the lactated ringers, this is also isotonic. So we know that lactate, 1 milliequivalent of lactate is converted into 1 milliequivalent bicarbonate in the liver. So when we need more bicarbonates, we can use lactated ringers. But for that case, we must be sure that the liver function is normal because this lactate is going to be metabolized in the liver into bicarbonate. If the liver is not functioning well, the lactate will be not converted into the bicarbonate, so it will be an added stress over the liver instead that we are doing anything good to the animal. Then there are amino acids. Amino acid hydrolysate solution, 10% is available. This is hypertonic, and this is also used in parenteral alimentation. Sodium bicarbonate, 7.5% is available. That is 1 milliequivalent per liter hypertonic solution. This is alkalinizing. So in cases of acidosis, we can use this as an additive also. Then we have the potassium chlorate solution, 14.85% available in the market. It is about 20 to 40 milliequivalents per ampule. It is a hypertonic solution, and in severe cases of potassium deficiency, we can use this solution, potassium chlorate solution. So this was about the fluid and electrolyte imbalances. Then in the next lecture, we'll talk about the acid and acid base abnormalities. So that's